Question 1. A patient with newly diagnosed type 1 diabetes asks, why insulin cannot be taken orally? What is the best explanation by the nurse? A. Oral insulin is not absorbed in the small intestine. B. Insulin is a protein that is destroyed by gastric enzymes. C. Insulin is more effective when injected subcutaneously. D. Oral insulin interacts with food and loses effectiveness. Answer: B. Insulin is a protein that is destroyed by gastric enzymes. Question 2. A nurse is educating a patient with Addison's disease about preventing an adrenal crisis. What should the nurse include? A. Limit salt in your diet. B. Double your steroid dose during stressful events. C. Take your steroids every other day. D. Avoid all forms of exercise. Answer: B. Double your steroid dose during stressful events. Question 3. A patient is admitted with thyroid storm. Which finding requires immediate intervention? A. Temperature of 103.8 degrees Fahrenheit, 39.9 degrees Celsius. B. Heart rate of 160 bpm. C. Blood pressure of 180 over 100 mmHg. D. Seizure activity. Answer: D. Seizure activity. Question 4. A patient with hyperparathyroidism is at increased risk for which complication? A. Hypocalcemia. B. Bone fractures. C. Tetany. D. Weight loss. Answer: B. Bone fractures. Question 5. A nurse is assessing a patient with long-standing Cushing syndrome. Which skin change is expected? A. Bronzed pigmentation. B. Vitiligo. C. Purple abdominal striae. D. Petechiae on the chest. Answer: C. Purple abdominal striae. Question 6. A patient with SIAD has a serum sodium of 120 milliequivalent/L. What symptom should the nurse immediately report? A. Headache. B. Dry mucous membranes. C. Abdominal cramps. D. Lethargy. Answer: D. Lethargy. Question 7. Which hormone imbalance is responsible for moon face, truncal obesity, and buffalo hump in Cushing syndrome? A. Increased insulin. B. Decreased ADH. C. Increased cortisol. D. Decreased aldosterone. Answer: C. Increased cortisol. Question 8. A nurse is reviewing lab results for a patient with type 2 diabetes. Which result requires immediate attention? A. A1C of 8.2%. B. Blood glucose of 250 milligrams per deciliter. C. Potassium of 5.0 milliequivalent/L. D. pH of 7.25. Answer: D. pH of 7.25. Question 9. Which assessment finding is most concerning in a patient with pheochromocytoma? A. Headache and diaphoresis. B. Constipation and fatigue. C. Sudden, severe hypertension. D. Weight loss and insomnia. Answer: C. Sudden, severe hypertension. Question 10. What should a nurse prioritize when administering for calcium gluconate to a hypoparathyroid patient? A. Monitor for hypernatremia. B. Monitor for cardiac arrhythmias. C. Monitor bowel sounds every hour. D. Assess for pupil reaction. Answer: B. Monitor for cardiac arrhythmias. Question 11. Which task is appropriate to delegate to a licensed practical nurse, LPN, caring for a diabetic patient? A. Administer for insulin. B. Teach patient about insulin pumps. C. Monitor for signs of hypoglycemia. D. Adjust the insulin dosage. Answer: C. Monitor for signs of hypoglycemia. Question 12. A nurse is caring for a patient with diabetes insipidus. Which finding best indicates treatment effectiveness? A. Urine output of 150 milliliters per hour, B. Serum sodium of 150 milliequivalent/L. C. Decrease in thirst. D. Increase in weight by 1 pound. Answer: C. Decrease in thirst. Question 13. Which assessment is a priority for a patient receiving methimazole for hyperthyroidism? A. Monitor bowel function. B. Monitor for signs of infection. C. Assess muscle strength. D. Assess urinary output. Answer: B. Monitor for signs of infection. Question 14. A diabetic patient is unconscious with cool, clammy skin. What should the nurse do first? A. Notify the healthcare provider. B. Administer glucagon IM. C. Recheck blood glucose. D. Place the patient in a side-lying position. Answer: B. Administer glucagon IM. Question 15. A nurse caring for a patient with Graves' disease notices restlessness, sweating, and palpitations. What should be the nurse's priority action? A. Encourage rest. B. Call the provider. C. Check vital signs. D. Lower room temperature. Answer: C. Check vital signs. Question 16. A client on long-term corticosteroid therapy develops a minor infection. What is the nurse's priority action? A. Administer the prescribed antibiotic. B. Encourage fluid intake. C. Monitor for worsening symptoms. D. Notify the provider immediately. Answer: D. Notify the provider immediately. Question 17. A nurse suspects a thyroidectomy patient is developing hypocalcemia. What is the first sign to assess? A. Tingling around the mouth. B. Tachycardia. C. Elevated blood pressure. D. Fatigue. Answer: A. Tingling around the mouth. Question 18. A diabetic patient states, I always take my insulin before breakfast, but I feel dizzy around 10 a.m. What is the best response? A. That is a normal side effect. B. Let's check your blood sugar at that time. C. You should increase your insulin dose. D. Skip your morning insulin on busy days. Answer: B. Let's check your blood sugar at that time. Question 19. A patient is admitted with hyperosmolar hyperglycemic state, HHS. What is the nurse's priority assessment? A. Ketone levels. B. Airway and breathing. C. Serum calcium. D. Skin turgor. Answer: B. Airway and breathing. Question 20. A nurse is caring for a patient with chronic hypothyroidism. Which statement indicates the need for further education? A. I take my levothyroxine on an empty stomach. B. I stop my medication when I feel better. C. I avoid taking calcium supplements near my dose. D. I understand it may take weeks to feel improvement. Answer: B. I stop my medication when I feel better. Question 21. A nurse is teaching a patient with newly diagnosed hypothyroidism. Which statement by the patient indicates understanding of the condition? A. I will take my medication with food. B. I may feel sleepy and gain weight easily. C. I should avoid exercise to prevent fatigue. D. I can stop the medication once symptoms improve. Answer: B. I may feel sleepy and gain weight easily. Question 22. A nurse receives report on 4 patients. Which patient should be assessed first? A. A diabetic patient with mild pedal edema. B. A patient with hypoglycemia who is confused. C. A patient with hypothyroidism who is constipated. D. A patient with Cushing's reporting a moon face. Answer: B. A patient with hypoglycemia who is confused. Question 23. Which endocrine gland regulates metabolism, growth, and development? A. Adrenal cortex. B. Pituitary gland. C. Thyroid gland. D. Pancreas. Answer: C. Thyroid gland. Question 24. The nurse is caring for a patient who had a thyroidectomy. What is the priority postoperative assessment? A. Assess for nausea. B. Monitor for hypocalcemia. C. Check for wound drainage. D. Monitor temperature. Answer: B. Monitor for hypocalcemia. Question 25. A patient with SIAD is receiving hypertonic saline. What is the most important nursing action? A. Monitor lung sounds closely. B. Measure blood pressure every 8 hours. C. Encourage oral fluids. D. Monitor urine glucose. Answer: A. Monitor lung sounds closely. Question 26. A patient is receiving levothyroxine. Which finding should the nurse report to the provider? A. Heart rate of 102 BPM. B. Weight loss of 2 pounds in 1 week. C. Feeling anxious and tremulous. D. Mild increase in energy level. Answer: C. Feeling anxious and tremulous. Question 27. Which laboratory finding would confirm the diagnosis of diabetic ketoacidosis, DKA? A. Blood pH of 7.45. B. Serum glucose of 120 milligrams per deciliter. C. Serum bicarbonate of 12 milliequivalent/L. D. Positive urine for protein. Answer: C. Serum bicarbonate of 12 milliequivalent/L. Question 28. The nurse notes a positive Chvostek sign in a postoperative thyroidectomy patient. What should be the next action? A. Check the potassium level. B. Administer calcium gluconate 4. C. Increase oral calcium intake. D. Provide supplemental oxygen. Answer: B. Administer calcium gluconate 4. Question 29. Which hormone is responsible for raising blood glucose during stress? A. Insulin. B. Cortisol. C. ADH. D. Calcitonin. Answer: B. Cortisol. Question 30. Which teaching point is most important for a patient starting corticosteroid therapy? A. Take the medication on an empty stomach. B. Report signs of infection immediately. C. You can stop taking the drug once you feel better. D. Avoid foods high in potassium. Answer: B. Report signs of infection immediately. Question 31. A patient presents with polyuria, polydipsia, and weight loss. What endocrine disorder should the nurse suspect? A. SIAD. B. Hyperthyroidism. C. Diabetes mellitus. D. Addison's disease. Answer: C. Diabetes mellitus. Question 32. A nurse is teaching a diabetic patient about foot care. Which instruction is appropriate? A. Soak your feet in hot water daily. B. Cut your toenails straight across. C. Walk barefoot to increase circulation. D. Apply lotion between your toes. Answer: B. Cut your toenails straight across. Question 33. A patient with pheochromocytoma is being prepared for surgery. What preoperative medication is critical? A. Beta blockers. B. Antithyroid drugs. C. Corticosteroids. D. Alpha-adrenergic blockers. Answer: D. Alpha-adrenergic blockers. Question 34. Which patient statement indicates proper understanding of insulin self-administration? A. I will rotate injection sites within the same area. B. I can use the same needle for 2 injections. C. I'll store all insulin in the freezer. D. I'll massage the site after injecting. Answer: A. I will rotate injection sites within the same area. Question 35. A nurse is educating a patient with hyperthyroidism on dietary choices. Which food should be limited? A. Bananas. B. Shrimp. C. Chicken breast. D. Whole grains. Answer: B. Shrimp. Question 36. Which lab value requires immediate intervention in a patient with Addison's disease? A. Potassium of 5.1 milliequivalent/L. B. Glucose of 92 milligrams per deciliter. C. Sodium of 128 milliequivalent/L. D. Calcium of 9.2 milligrams per deciliter. Answer: C. Sodium of 128 milliequivalent/L. Question 37. What is the purpose of administering fludrocortisone to a patient with Addison's disease? A. To suppress the immune system. B. To replace aldosterone. C. To correct low glucose. D. To reduce inflammation. Answer: B. To replace aldosterone. Question 38. A patient with type 1 diabetes reports morning hyperglycemia. What should the nurse assess first? A. Bedtime insulin dose. B. Evening snack intake. C. Symptoms of hypoglycemia at night. D. Hemoglobin A1C level. Answer: C. Symptoms of hypoglycemia at night. Question 39. What is the effect of parathyroid hormone, PTH, on the body? A. Increases renal excretion of calcium. B. Decreases calcium absorption in the gut. C. Increases blood calcium levels. D. Inhibits osteoclast activity. Answer: C. Increases blood calcium levels. Question 40. A nurse is caring for a patient on long-term prednisone therapy. Which finding requires further evaluation? A. Mild fatigue. B. Slight weight gain. C. Delayed wound healing. D. Increased appetite. Answer: C. Delayed wound healing. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.